Good morning, and thank you so much for joining us today for this talk at the brilliant Beauty Triangle Festival. My name is Polly Vernon. I'm a writer and a beauty obsessive. That's kind of more of a personal pursuit. And I am so excited to be joined by this amazing panel today to talk about Skin 101. First of all, Dr. Catherine BORYWIESICZ, who is a dermatologist, Dr. Elizabeth Hawkes, who is an oculoplastic surgeon and an aesthetic practitioner, and who also did my upper eye blepharoplasty last year. We're getting onto that shortly. And the legend, the icon, Ruby Hammer, makeup artist, who was also the first person to ever do my makeup professionally. How lucky was I when I was about 24, 25? Did you know that?
Wow. I forgot.
Welcome all of you, and welcome to you three. I'm so excited to hear your different perspectives on skin. And I would like to start with you, Catherine, if that's okay.
Okay, lovely.
Was there a time when you first became aware of how important skin is to us? And what was that?
Okay. So just dive straight in.
Dive straight in, go for
Okay,
it.
so probably I came to dermatology quite late in my medical training. So it's not the usual story of, I had bad skin and this is how I kind of found dermatology. For me, it was very much about looking after incredibly unwell patients in the hospital, being called to give specialist opinions about what could be wrong with them to try to really help them get better on the right treatments.
Yeah.
So it was that level of real attention to detail, looking at the pattern of rashes, looking at the history, looking at signs on the skin that would give me clues. So it's more like detective work.
Okay.
And then thinking how their body, how their immune system was creating that and what I could do to improve it. And that for me was really, it kind of sparked my interest in dermatology. That's how I found it as a specialty.
Because the skin is just giving us all kinds of clues to what's going on in our body generally.
Absolutely. So I always say to patients when I see them in clinic, most of what you see on the skin is driven by internal health.
Okay.
And as a doctor, as a dermatologist, it's our responsibility to be able to find out what those clues are and then get the right investigations organised.
Did you have the eureka moment on that? Was there one patient where you kind of saw that connection really obviously?
Yes. So in a lot of the units where I worked in central London, we would often look after very, very complex cases. And I had an amazing mentor who always used to really push us as trainees. And he would say, I want you to have 10 spot diagnoses on each patient. So you really had to kind of be very, very perceptive and pick up every clue. And there was one eureka moment where I was called to see an incredibly unwell patient who had literally not been improving for many, many weeks.
Okay.
And it was the fact that we managed to pick up one sign on the skin which revealed the fact that it could have been a disseminated fungal infection. Put on the right treatment, totally turned the corner and still happy and alive to tell the tale. So that for me was a eureka moment. That made me feel like
Incredible.
all the training, all that perception, all that hard work really made a difference
totally
to
worth
someone.
it. What was it? What was the...
Oh, so it was a diagnosis called disseminated histoplasmosis, incredibly rare, small print. But if you have unwell patients, we often think about bacterial infections rather than thinking about disseminated fungal infections. So if you don't think about it, it's not on your radar and you wouldn't necessarily be on treatment for it. And you can obviously become very unwell with those diagnoses.
How long have you been working as a dermatologist?
Oh, God, many years. So probably around 15 years in the field of dermatology and many years of that as a consultant dermatologist. And every day you learn something new. It's an incredible specialty. I'm very passionate about it.
What have you seen change in the field of dermatology over that time?
I think so where do we start? So I think everybody is definitely much better informed about their skin health, but there's also an awful lot of noise around it as a specialty. And I think some of that importance on really focusing on the essence of what's important about skin. So really, from my perspective, it's about the health of your skin, not about the age of your skin or anything else. It's the health of your skin and getting that kind of inner glow from the skin that comes from happy, healthy skin. That's the key. So a lot of noise, a lot of new treatments, a lot of new promises. And perhaps it's a little bit of an overwhelming field. So,
I would say so.
Yeah.
I think we can all appreciate that.
Now, I remember my first kind of experience of science-based skincare and my first kind of awareness of it, even as a thing, It was the number 7 boots moment. Do you remember?
Yes, I do. It's
Yes.
about 15 years ago.
Yes. Now, I was sat on the sofa with my mum
Yeah.
as a kind of very geeky sort of, doctor, loving my immunology. And I sat on that sofa and I looked at the data that was being presented where they showed sort of research proof, so scientific proof that you were seeing an improvement in someone's skin quality using a product. And I turned to my mum and I said, oh, at last, because actually this is how we should focus on looking at and kind of really pushing quality products and
Clinical.
Yeah, clinical products.
So, and that, what was it retinol that was in that?
It was a retinol,
It was like a first mass-produced retinol,
Exactly. And they just took that time. They took this product, and rather having a product that said, 9 out of 10 women feel great after using it, they said, let's actually see if we can show it scientifically. Let's see if we can show that. And now I think there's a lot more focus on trying to do that with products.
We expect that.
Absolutely.
As consumers, we expect that.
Exactly.
That's so interesting. I had no idea that was the first one, but of course I can just remember like the huge fuss and how it sold. It kept selling out, didn't it?
There were literally the next day, there were queues kind of down the street outside every Boots. Yeah, so that was for me a really, really important moment because I think as consumers, we were craving that rather than just being told that something felt nice or would make our skin glow. You actually wanted to see some science behind what you were being sold.
We were totally ready for it.
Yeah, absolutely.
And since then, we've seen the active skincare market kind of grow and grow and grow. Has that been exciting for you, or do you think that comes with some?
So, always two sides, okay? So, yes, very exciting. Lots of information, lots of focus on ingredient-focused skincare, which is something I love as a dermatologist. But often too many products, too much hype. And I have to say, when we look at a lot of new products coming out as a dermatologist, sometimes even we've never heard of the ingredients that are purporting to be, the latest kind of, crazy sort of product for your skin. So you have to have this element of always remember, you look at what's there, but remember not to overdo it and remember about what your skin really needs. And it doesn't always need the latest kind of buzz product or the latest new thing that's coming out.
And your feeling is that it is health we should be focusing on,
100%.
Healthy looking skin above anti-aging skin, above anything else. What are the signs of healthy skin, and what should we be doing to back it up?
So I think it's really interesting when you look at how people perceive beauty of the skin. What are we all chasing when we're looking late at night and scrolling through those wonder products of, what's going to give us that lovely glow in the skin? And really, I think probably one of the most important things is clarity, clarity of your skin. So you want the light to bounce off your skin. I don't know if you'd feel the same about that, sort of about clarity.
I'm glad you turned this way because I'm struggling to hear.
Okay. Do you want to swap with Elizabeth?
Yeah, the switch. Yeah, absolutely.
Thank you, Elizabeth.
That's good. Switch.
So is that what you feel, Ruby? That clarity, skin clarity is one of the things that we all want most.
Well, the thing is, a few years ago it came out,
You speaking to your mic, my love?
Okay, a few years ago, the obsession was about lines and wrinkles.
Yeah.
That defined whether you had healthy, youthful skin. And I think after the research that came out, that you realise that no, it was about the tone and clarity actually gives you a youthful look. I don't say young, but youthful, so that it's perceived as healthier. And because the fine lines, we've all going to get something, because otherwise it means you're a robot and have no expression, nothing. And so that is more important, that evenness and a glow and that's why we want to tackle, hyperpigmentation and all that, and not just the depth of wrinkles and lines.
So it's an overall impression of of
Because
clarity.
you look at it overall, you don't. You don't. What's this? What's that? What you're doing? You just see that. That's what the brain perceives.
And we have seen this change over the last 2 or 3 years, or
Yeah. And this is healthy,
And this is health.
Yeah, this is where I feel at the moment, like finally my kind of ideas of what makes kind of good, healthy skin, it's starting to come through into that mainstream sort of thing that people are looking for, getting your skin working better, keeping it healthy, maintaining the health of your skin. That will really be the most important thing.
And does that vary from person to person, what we need?
Yeah. Yeah, 100%.
So, yeah, go on.
Oh, sorry. So I was going to say, where do you start? So
Yeah,
what are the first
absolutely.
easy things that you can do? So not everybody's skin can tolerate a lot of active ingredients immediately. So the first thing that you need to concentrate on is making sure there's nothing worrying going on your skin.
Right.
So first assessment with me will always include looking at any underlying evidence of sun damage, anything I need to kind of jump on and treat, like
Yeah.
a pre-cancer or preventative treatment for the skin. And sometimes that will involve, really kind of paring back their skincare routine and getting them on some prescription products to kind of deal with certain areas of damage.
Right.
Now, once we've done all of that, you need to start building a routine. And for me, the routine starts with a very, very gentle cleanser and not overwashing.
Okay.
So
So this whole kind of double washing, no. Oh, okay, I will stop doing that immediately.
So what I really like is water wash in the morning. So generally, unless you have very, very oily skin,
Yeah.
you don't need to wash away the natural kind of oils and things that are on your skin from overnight, okay? So
Wow.
you've just got your light night products that you've been using. So a little bit of a water wash is perfect place to start in
Right,
the morning.
okay.
And that little spritz of cold water is a wonderful thing for your skin,
Yep.
right? We all love it. It helped me this morning depuff my eyes
Yeah, it's
before I
good for the
came on
depuffing
stage.
for sure.
And then what you need to do is really get the moisture on. So we are so rubbish at moisturizing enough.
Are we?
I think so.
Why do you think that? What, do we over-focus on serums and...
Exactly.
Okay.
Yeah. So really focusing on your ingredient-driven skincare rather than actually saying the first thing I've got to do to allow my skin to tolerate these ingredients is to really build the hydration and
Right.
support the skin barrier. Now, happy, healthy skin barrier, you're already well on your way to getting your glowy glass skin look. Okay, that's it. So
Yeah.
the most important product is finding the right moisturizer.
Right. Okay.
And if you're someone who can't tolerate nice rich moisturizers, so certainly I'm at a stage in my life where my skin seems to drink up moisture. It's
Yeah.
loving it at the moment. But if you're someone who has congested skin, there are lighter ingredients that you can look for to hydrate the skin. So these are molecules like hyaluronic acid, ceramides. So these are things that will be light products, but they work well to draw moisture into the skin.
Okay.
And then you can start adding in, only then, and of course, sunscreen, the most important bit of your skincare routine, the best anti-ager out there, super important.
But that's final step. SPF?
Yes, so in the morning.
Okay.
Now, the next step, and where do you kind of then start to work? So you need to think a little bit smart about this. So your active ingredients start to become quite expensive. So where do you want to spend your money? What is the problem that you want to deal with?
Yep.
A lot of that for my clients will vary depending on kind of what time of the year it is. So from September, we'll concentrate on clarity and kind of helping with areas of pigmentation because autumn and winter give us a really good time to kind of do that.
Yeah.
And then
Because less sun exposure.
Exactly. And then also you might want to start adding in some prescription sort of retinoids, or you might want to start a bit lighter with some retinols and over-the-counter products. Antioxidants, very helpful, but very, very, very sensitizing to the skin.
Right.
So you've got to pick what you're going to go for and pick one at a time.
One at a time.
One at a time.
Yeah,
and
I mean,
slowly
that is
introduce.
an issue, isn't it? Because I
Yeah.
think we are, again, bombarded by so much product.
Yeah.
And we don't realize that we're often doubling up on ingredients in 2 different serums.
Yes.
And so one serum.
Yeah, to start off with, get going. Make sure your skin is happy with this and give it time. So skin takes time to respond to a lot of these ingredients. So your natural skin cycle, we'll often talk about it being 4 weeks, roughly. So
Yeah.
that's why most dermatologists will say, don't give up on what I'm giving you for
Yes.
4 weeks.
Yeah.
Give it a chance.
Yeah.
But as we get older, as we age, that takes even longer. So we could be heading towards 6 weeks.
Yeah.
So you really do need to check that your skin can tolerate some of these
Right.
ingredients. And some of them will not work if you're using them kind of all the time. Sometimes it's better to just perhaps have a once a week little addition, like a burst of treatment. So this is the way that I tend to recommend exfoliants are used. So you want to keep the skin hydrated, but then once a week it's nice to get the debris off the skin so that you can then have your ingredients penetrating well into your skin. So that would be like a once a week treatment.
Okay,
Yeah.
fine. Are you concerned by the amount of, misinformation as well that we're getting from social media?
Yeah.
What's the most ridiculous thing you've seen
Oh,
lately?
where do I start? Well, look, a pet peeve for me is this really, really ghastly stuff called melanotan. I don't know if you've come through it.
Never even heard of it.
Right. So
Melanotan.
Melanotan. So it's illegal in this country.
Right, okay.
And people
That's always a red flag,
Yeah, it's
I
always
think.
a red flag. But you know, the way that things are marketed or sold, perhaps on social media, it doesn't look that way. But
Yeah.
these are illegal products, and they boost natural melanin production. And they're often used associated with sunbeds, but they can cause melanoma and they can cause skin cancer.
Whoa.
Now,
So this is stuff that is being topically applied that can cause the
this is
melanoma.
stuff- so in the old days, when I say old days, 15 years ago, when I started out in dermatology, this was something that was always sold under the counter in tanning shops as an injection that you had to put in your tummy, a bit like an insulin injection,
Okay.
right? Now it's been reworked into nasal sprays that young people are advertising on social media, and there are very young children using this to kind of boost their tan when they go into
because there's
sunbeds.
a whole tanning revolution
There
going on.
is,
Jojo,
there
I don't think
is.
it's here,
Yeah.
told me all about that last
It's
year.
really
extraordinary.
scary.
Yeah.
So this stuff is super scary. It's out there, you know, clients are using it, kids are using it. It's really frightening. So that for me is just infuriating.
Please, can we stop this now? But it's illegal anyway,
It's
so yeah.
illegal, but it's still out there. So people just need to be aware of it and just say, you know,
Yeah, no,
no,
absolutely
a
not.
hard no.
Well, that's terrifying.
Yeah.
Thank you.
Yeah.
Ruby, do you want to
I couldn't. Love, you're all kind. You're all lovely.
So yeah, Ruby, I don't know if you know this or remember this, but you came and consulted on Miss Selfridge makeup range about
my
30
gosh.
years ago. And I
Long
was
time
junior
ago.
in the office, and I was your model for all the training videos.
Were you?
Honestly, it was when I thought, I have arrived. This is it. It was
Well-
amazing. I'm so lucky. And also, by the way, she looked exactly the same.
It's not true, but you're very
It's
kind.
totally true. So, as a makeup artist, when did you become aware that skin was kind of the key?
I think my mum was a very young mum, so I was always impressed with how she would be cooking and sweating, and then when she did her makeup for a cocktail thing or a big work thing for my dad, how transformative that
Right.
was.
So
And
that really
then-
struck you
So
as a
that's on a
kid.
personal level. And then I finished my university and I got an opportunity as a assistant, as a makeup assistant.
What did you study?
I studied economics.
Okay. Okay.
So
Oh, right.
complete-
The natural progression from economics to makeup.
And all that, but it was not practically, sort of just flung in there. And that's when I probably realised what they call foundation base.
Yeah.
It's the base of something. And I realised, because up to then, my skin, touch wood, was okay. In my adolescence, I didn't have, because I think you focus on skin when you've got a problem, or you take it for granted if it's all lovely. So I didn't have acne in that sense. So
Yeah.
I was kind of, that didn't come on my phone. But when I saw that professionally, when I had to, it's the first time I was assisting this lady, that if you didn't get the skin right, all this thing that I was obsessed with, eyeshadows and lipsticks and cheek colour, it wouldn't have any bearing
Yeah.
if you didn't get that base.
So
and
that was-
that's when it first hit me that, my God, I've got to pay
this is
attention.
everything.
We're going steps back.
Yeah.
You do that prep properly.
Yeah.
And everyone's skin is not the same.
Yeah.
So you've got to learn
look at
way.
them.
Yeah.
Yeah.
All of that. And,
It's
like.
not called foundation for nothing.
Exactly.
So what did you observe and what did you learn kind of really early
Well-
on about prepping your skin?
I wasn't formally trained, so it's not like I went to makeup school and learned something. I learned,
learned on
the
the
job.
Yeah. Best
And
way.
it was exactly those kind of things, like pay attention that she's really fair. What is the, learning about undertones, that some people are neutral, some people are a bit warmer, some people are a bit red, or mixture of that. Now we have that luxurious thing where brands, when they have skincare or they have foundations or concealers or correctors, they have 50 shades and all. That didn't exist at that time.
So that was my next question. So
it
what
was,
were you doing?
It was fine-tuning and learning all of that gradually, that, oh my God, an olive-skinned person of a certain way, and then someone who is very fair, but she might be alabaster cream, a bit like you are, but somebody who is Irish and got very pinkish, flush skin. And I just had to learn.
So were you also just mixing?
Yes.
Because your
You had
products
to-
were so limited.
Even now, I've got to say, I think most people think that there's one foundation.
Right.
It's like a holy grail they're chasing.
No.
But actually, when you're on a professional way, on a shoot or in behind the studios or wherever they're influencers, it's more than one base colour.
we all
sometimes.
need a few.
Yes.
How many
And
do you How many in the average face? Like 3?
I think a minimum of 2, because the periphery on your face and then
Yeah.
what is on under eyes, and to get that, because skin isn't the same all over. I've got hyperpigmentation, as you can see. I'm always darker here. I'm lighter here. So to match that, I'm going to need 2 different kinds of base, and sometimes it's 3. So that's why take the time to really, don't do it in a rush. I'm just going to do it without daylight. The girl tells me this matches, and off you go. Have some time, see what you've had before, and then see, do I need 1 or 2 shades that I can use in the winter and less, in the summer, or a darker colour or not. But it's not just one
ever
bottle.
for any of us. Did you have a moment like Catherine with the number 7 when brands started sort of really catching up, or was it when you launched Ruby and Millie? Was that part
No,
where you launched?
I think I had that professionally, but in Ruby and Millie was a formalising of that. I could put it to practice, all the things that I picked up.
It was so amazing when it launched. It was so exciting when it launched.
What it meant is, previously, you would just blend up
your
whatever
best.
in your kit, because that's what I was doing. Then when you're offering something to someone, if I didn't try and make it a bit easier for that consumer, what was I doing? I'm starting from scratch, not like consulting on an existing brand that had, we've got so many colours, we're just going to add 2, or not that. So I had the luxury of starting from scratch, and I wanted to do it that way, and I was able to do it that way.
Which must have been really
Well, with quite a few fights, but I managed to achieve it, so that was good.
And it changed the beauty industry, didn't it?
I think, with hindsight, at the time, you're just fighting the battle as you fight. You're not thinking, what impact has it got on the industry? I'm just doing what I was, because it was our brand and with our partners, and you wanted to make it commercial but creative. It had to hit all the spots. And it's now, when you stand back 20, 25 years later, that the things you're saying, you think, Jesus, oh my God, I'm glad we went gung-ho and we stood up for ourselves.
Yeah.
And it's the only way I know. So it's fantastic. It's fantastic.
Do you watch how the cosmetics industry has changed since then even? And I mean, it's quite overwhelming, isn't it?
You'd have to be kind of dumb and blind and mute if you didn't. Because the thing is, our beauty industry or cosmetic industry is just a reflection of life.
Yeah,
if everything is changing everywhere, it's
quite
going
quickly.
to have impact. Yeah, it's going to have impact here too, whether it's the social media or the way people buy, direct to consumer, all these things. So this all has impact.
Yeah.
And I think we're going through another major shift.
Do you?
Right now, yes.
And from what towards what?
So from things where just how you buy. Before you would Google something and then then it would send you to that website to get it. But now there are people like the Amazons, the Sephora. So you've got bricks and mortar, you've got online, but also ChatGPT allows you, or is going to allow you, to buy.
Does it?
Yes.
I did not know
so
that.
They're looking, there are things coming to us going, is your brand available to be bought, not just on... And I'm like, how many more avenues and things have we
so
got?
You think that
there are many
much,
things. Yes.
And then we're overbuying.
There's just, choice is a brilliant thing.
Yeah.
But when it's overwhelming, like you were saying earlier, that you don't know what you're doing. So in the end, you have to have I just think we're 8 billion people on the planet, and each one of us is unique.
Yeah.
So the biggest thing we can do is, the more knowledge you have about your skin, what you like, what works for you, what doesn't work for you, without taking away experimenting or the joy of trying something new, that you can say, I've tried that doesn't quite work, so I'm going to explore something else. That's where, if you have a pillar, a base that you are securing, then you can ping out. Otherwise, you're going round and round and round and get completely confused.
How do we get that? How do we get that pillar? Is it by going to beauty halls and getting
I think first you take a bit of responsibility for
Right.
your own face, your routine, your features, your colouring, everything that you've been blessed with, and not look at it as a
Yeah.
negative. You know, these are
So-
unique to you. No one else on the planet, even if you've got a sister or a mum or somebody, is like you. So when you start there and you're not looking to somebody else to just wave a magic wand and make
Right.
it all right for you, it means you can then ask. I like a dewy foundation. Matte might be in trend, but this works better for me.
Yeah.
What are the choices out of your offerings? Then you can be guided that way.
It's slightly the opposite of influencer culture. Then it's not trying to look like other people. It's trying to look like yourself.
I think if we start with ourselves,
Yeah.
then you're able to take what the common, oh, so-and-so is similar, those are more things, I can glean things for me. But I think most of us are now so want that quick, easy
Yeah,
fix,
yeah.
and you almost want somebody to just do it. I'm paying, can you just fix it? And I'm
Yeah.
like, no, you
No.
wouldn't. You need, the better you do that, whether that's exercise, your water, the way you buy the tools, the way you buy the products, and who you listen to, if you tone it and tailor it to yourself, you'll get a better outcome,
So
better
we need
results.
sort of self-knowledge, self-acceptance, self-love, first of all.
I think you can't beat that.
No, yeah. It's a very good starting off point, isn't it? It's a very
Yes.
good jumping off point. Thank you so much.
Thank you.
Dr. Elizabeth, what was your kind of inroad to, I mean, it's totally different, actually, your inroad to aesthetics and skin and making people look better.
Well, probably growing up as a teenager, my mum was always into her skincare. She was always lotions and potions, and she used to say there's a cream for everything. And then I always knew I wanted to do eyes. So then just starting medical school, doing eyes, everyone knew me as the one who wanted to do eyelids. And I used to actually do the makeup of all my friends in the house that we lived
Yeah.
in before our balls and bops, because I was
Okay.
always into eye makeup as well.
So it was
that's sort of-
always eyes?
It was always
It was
eyes.
always
That's
eyes.
how I got into it. But with the
What was it about eyes?
the very delicate, precise nature of the surgery, I always liked that. But I've also always been interested in the aesthetic side as well, from makeup, the beauty side, and that was probably growing up as well.
And then you got into medicine.
So then I did.
So what was your route? So,
Uh,
so at this point in time, it's purely kind of
Well, I went to
joy of-
medical school and I liked eyes. And then I started surgical medical training like everyone else.
Yeah.
And then I wanted to specialise in ophthalmic surgical training. And actually, it was the second week of my training, week 2 of 8 years. And I saw a ptosis operation, and that's an operation where you make the eye look more open.
Right.
I remember thinking, wow, this is amazing.
just because the results were so powerful.
Yeah, you made an eye look more open and it changed the whole face.
Yeah.
And that's when I thought 100% I want to do oculoplastics, because it combined the technical detail of ophthalmology, which I always liked, but also with the aesthetic side. So then I said, I want to do oculoplastics. I said, oh, can I do the next one? I wrote down all the steps. They're like, calm down, you've got a long way to go. And then, years and years later, then...
So what was the progression? Like, how do you get to a point where you're doing your first blepharoplasty?
Oh, surgical training, you have to watch loads and loads and loads. I mean, the old phrase was see one, do one, teach one. That was
See
like
one, do one.
see one, do one, teach one. That's
one.
the
Okay,
training.
that's-
But the C1 phase can take 2 years. The
Elizabeth,
doing
I've
one
just got
phase
to-
can take another 3 years, and then the teaching one
I just
right
want
at
to
the end of
ask
your
you,
training when you're a
Are
consultant.
these done, they're not done in clinics? Are you in actual hospital to do these operations? Like, are they,
What was that?
Are they in the hospital?
Yeah.
Or they're not in like your clinics or anything like
No,
that?
no,
So-
you
so it's
can't
a
start
proper-
private practice until you're a consultant and you're on the specialist register, you've done fellowships, there's exit exams, and really by the time you're a consultant, you've done thousands of cases under your wing, and then you're free in private practice. But there's a very rigorous training pathway you have to go through in the UK.
And it really is. I mean, again, it's about health, isn't it? It's about kind of opening up the face.
Yeah.
It's an operation that gives the same impact that we were talking about earlier. So tell me about when I walked into your surgery.
Well, obviously doing your blepharoplasty was amazing, because I think the article that you wrote in the Sunday Times Style really broke down the stigma that's surrounded around blepharoplasty surgery and any type of cosmetic surgery to the face. The way you wrote it, everything you said, you were nervous before you came in. What's she going to say? Am I crazy? Am I really going to do this? Then you have your consultation and we go through the risks and benefits. And I think you were quite reassured and you thought, yeah, I'll do it. But then obviously the nerves kick in again on the day of surgery. But the way you wrote it was brilliant because a lot of patients have said that I've seen subsequently that they can really relate to how you were feeling.
Yeah, I mean, I didn't mean to make this all about me, really. But I didn't realise when I wrote that piece that how much of and it's what we were talking about earlier. There is stigma and there is shame around these kinds of operations, which I think is related to aging, which I think is nonsense, which is why I'm quite happy to talk about it. I am not ashamed. I am not stigmatised about getting older. So why would we pour shame and stigma on anything that helps with that process? One of the things I'm interested in talking to all of you about is actually how we walk the line between making our faces and our skin and our eyes look as good as they possibly can without making it a sort of anti-aging movement. So without making it an ageist movement, I suppose. Is there a line to walk there? And how do we do it?
I think, again, it's a very complex subject.
Yeah.
So you were very bold in saying, I'm not ashamed about that, because there is that bit, because I look at it as though there are like short-term, mid-term and long-term results from what you want to achieve.
Yeah.
So for somebody, if they're always, no, I'm going to be natural, I'm going to be this, or I'm aging gracefully, I'm going to explore creams and retinols and what other things. Then there's other ones that might be a gadget or something like that. And then there's a permanent thing that there will be nothing that will get the result other than getting that.
Yeah.
That is actually open and it's permanent. And that's it. And you can actually get on with your life in a different way. But you did the research. You found the right
I found the best.
person.
I found the best woman in the business.
You see what I mean?
Yeah.
So by that time, you realise I'm going for this, and this is what it's going to do for me, and that's it. So everybody has to. That's what goes back to my point. You know what it is you want, then you don't buy into whoever's trying to shame you or not shame you, or knowing this is quite an extreme thing, and there is a solution there. I need to explore, and then you go that way.
And then
it's
move
not
forward.
the same solution for everybody. Or you haven't got the budget, or you haven't got the expertise to lean out on. So,
but I think it's also the thing that you were talking about earlier, not starting from a point of self-loathing. Like, I don't hate myself. No. I just wanted to know what else was out there. Exactly. What do you think, Dr. Gunn?
So I think this is really interesting. So we were talking about health being the starting point, and I think that really helps kind of people to understand what they're trying to achieve.
Agree.
So health is key. Then we all have something that we don't necessarily feel confident about. And I think that's probably where you can start that journey. So we all have something that we are a little bit fed up with, or that gets us down from time to time. Whether that's acne breakouts, whether that's areas of fine line, whether that's sort of feeling tired, all of these things. And it's normal that we all want to look like the best version of ourselves. We want to feel like that person who's just back from holiday and not,
that's her.
Yeah,
that's who I want.
Exactly, and not, 4 coffees in kind of after being up all night with the kids or whatever. So I think there are things that we can focus on to really help people feel more confident in themselves, and that then allows it to shine from within, if you like. I'm a great believer in this idea of inner beauty. I think if you have a positive outset and you really feel positive about yourself and confident about yourself, we carry ourselves differently.
We do.
And
that's more attractive.
Exactly, very attractive.
Yeah.
So that's the key, really. If you can try to help people with some of those things that they don't feel so confident about, so they then start to feel more confident in their skin, and then that allows it to kind of, raise them up and feel more confident overall.
And that's actually nothing to do with youth or chasing youth, and everything to do with just,
No. Yeah.
Elizabeth?
Yeah, I mean, I agree with what's been said. I guess the only thing to add about it's all about how you feel inside. When you're doing blepharoplasty surgery on someone, all patients have psychological screening. So it's not just the time with me in the consultations to explore motivations. They then go on and have psychological screening, because it's just an extra layer of support, emotional support, just really delving in, why do you want to do this surgery? Even though it's very mild surgery, it's still, reducing hooded eyelids, reducing eye bags will have a big impact on the face. And I think fundamentally all patients want is to look, they don't mind their age, they just want to look fresher and they don't want to look tired. And that's That's always what I hear in the consultation. So they feel they look tired, but they're not, and it always goes to the eyes.
Okay, and to finish, can I ask you each what you're most excited about? What can you see that's changing, and where are we going next, and what kind of fills you with delight? Ruby, do you want to start?
I will start. There's so much to fill us with delight because we are in an era where I don't think we've had as much choice available to, I mean, whatever the 60s, 70s, 80s, 90s, whatever, you've got, everything is out there to actually help you in every aspect of it, you know, from skincare to makeup to medical surgery. So again, if you do that little bit of research to say, I'm in charge, I've got a choice.
Yeah.
You don't just have to be bulldozed. And
Just don't get sold at. Yeah.
just do that. So take advantage of all that's available to you. That's a positive.
Do you think physically experimenting with stuff, do you think being in shops and testing things
Well,
is...
whichever way,
Whatever
you
you
know,
want,
there are
whatever
tools
works.
online now that you can colour match your base, you can
Yeah,
do that.
true.
Whatever the appropriate tools are, just use them to see whether it makes an impact on you.
Yeah.
And do that. And also, there's a commercial value to people want to make money. So when they want to make money, they bring things to the marketplace. They do the research so that they can do, you know, so every standard gets pushed. So they want to do it. And I think that's a good thing
That's a
because
really
it
good thing.
means there's more choice for all of
And more
us.
information. Yeah.
Exactly.
Yeah.
That's it. And
So
take
it's about
that as a
taking the
positive.
time and learning. Yeah.
And don't do it with blinkered, you know, just don't do it blinkered and go for it because you have got, the world is your oyster. You really can pick what you want.
Amazing. Catherine?
So I'm really pleased to sort of announce that I'm hoping that 2026 is going to be the fact that we are no longer going to be damaging or hurting our skin.
That would be nice.
Trying to chase the idea of kind of, you know, the perception of beauty and healthiness in our skin. So this whole idea now that's coming through about regenerative skincare, and that's been my kind of mantra for so many years.
So this is a really good,
It's a
good term for
really
you.
good time.
And it's
So-
not an empty buzz term, it means something.
No. So basically trying to use sort of gentle products with clever encapsulation or delivery mechanisms, treatments that can be done with minimal downtime. Downtime meaning damage to your skin, really, you know, and recovery that needs to happen. So able to use those things regularly, consistently, and being able to really get the glow from within. That's kind of my favorite thing
Health
at the
and
moment.
glow, health and glow.
Yeah.
Dr. Elizabeth?
Well, I know I've been talking about it a lot already, but the blepharoplasty boom that we're seeing. So it actually, statistically, blepharoplasty surgery started to get more popular in 2021, which is sort of what we were all discussing anyway with COVID, wearing masks, working from home, looking at ourselves more than ever. So it's slowly been on the rise over the last few years. And this year, it's the most popular cosmetic surgery now, eyelid surgery. It's overtaken the other procedures. And that's statistically, not just in the UK, but worldwide. Men and women. So this year I'm really excited about that because I love blepharoplasty surgery and it's great, it's so popular and being talked about so much.
Yeah. Wonderful. Thank you all so much.
Thank you, Polly.
Catherine,
Thank you.
Elizabeth, and thank you all for joining us. That was a brilliant talk. Thank you. Really.
Thank you, Poppy.